TikTok has been all the rage lately, and our first topic is about a mother who recently went viral with a mysterious medical condition, but she's not the only one who's turning to TikTok for medical advice. Take a look. TikTok is full of medical mysteries, from surprising breastfeeding side effects.
I can shoot milk out of my armpit.
And peculiar skin conditions. To a nail growing under a nail. And most recently, a viral post of one pregnant woman's gigantic bloody lip growth. There are a lot of benefits to social media, but asking for a medical diagnosis may not be one of them. Well, Jackie, you and I know what this growth is, and
yes.
why do we know? Because we've been around the block. We went to medical school. We did residencies. We learned all about making the diagnosis, having a differential diagnosis, and going through those things and making a diagnosis. Okay, this turns out to be a pyogenic granuloma.
Yes.
I know it looks nasty. It looks gnarly. It's like, whoa, what is this?
Yes.
Leprosy or something like that? But it is. It's a pretty common condition. In fact, I just recently had one of these last week in the office, in the same spot, in the lip. And what it is, it's a buildup of granulation tissue, so-called pyogenic granuloma.
Right.
Full of blood vessels. They like to bleed.
Yes.
They may go away on their own, not always. Sometimes you have to treat it. But one of the questions we have, why does this happen in pregnant women commonly?
Now, this happens in approximately 5% of pregnancies, but we really do believe it's a hormonal changes. I mean, the hormones that pregnant women have just feed everything.
I almost said wreak havoc, but that's not nice. It affects, I mean, that's why your specialty is so involved. I mean, literally every part of the body can go a little haywire.
Everything grows in
Every
pregnancy.
system, whether it be ear, nose, and throat, or your
skin tags, whatever.
In cases of pregnancy, do you usually see them clear up?
We do. They typically clear up, but we do tell you come to the doctor, though.
Well, absolutely.
Yeah,
and people chimed in with bad medicine, right? I mean, they gave her all these ideas, and as we said, the big problem lies with misdiagnosis. I mean, it could have been a skin cancer.
It could easily.
It could have been an infectious process that if you start messing with it, could spread and get worse.
And you know, I tease that they're getting information from the street committee. That's my going joke when you're getting your information off the street.
And I don't care how big that street committee is. It doesn't trump one doctor who did the training and knows how to
create a differential diagnosis.
Well, that's exactly right. You know, in view of the fact that STDs are at a all-time high, I think you have to consider that too.
Absolutely. There was a recent study that a doctor at UC San Diego looked at Reddit's STDs related posts over a 9-year period, and guess what? 58% of people, of posts, explicitly asked for a crowd diagnosis. So they wanted the people to tell them what this was.
And that's the worst scenario, that you want to get a diagnosis from somebody that's...
You don't want to miss a STD.
No, you don't, because it's not just you.
Right.
It's everyone else that you're in contact with.
Absolutely.
I think that's another important point.
Right. Go see your doctor.
All right.
Call us.